Well, welcome, everyone. This is Jeannie White. Again, it's Social Connections on Passionate World Radio Network. You know that this station is a station where people can come and talk and tell their stories. They don't necessarily hear it elsewhere, but you will hear it here on Passionate World Radio Network. And today I have a wonderful person, and she's from the state of California, and her name is Susan Fernandez. Sorry, Susan.
No harm done, Jeannie.
I am a wicked person when it comes to, saying people's last names. I apologize. Well, I want to welcome you to the show, honestly, Susan. And I want you, if there are some things that you would like to give some background on, being a caregiver and how it all happened and where you are now. And I think that would be great for the audience.
Super, Jeannie. Thank you. First and most importantly, today is Alzheimer's Awareness Month. How fortunate am I? I'd like to thank you, Jeannie, for this platform and the awareness bringing to the Alzheimer's Awareness Month. Also, I'd like to give a shout-out to my buddy, Betsy Wurzel, whom I consider my sister from another mister. She, too, has been diligently advocating and making the public aware of this horrible disease. If I may, Jeannie, I'd like to give you a little background where I'm coming from and where I'm going. I was a previous long-distance caregiver to both of my parents, including friends and family members for over 15 years. I currently volunteer for the Alzheimer's Association. I've worked and volunteered for the American Cancer Society, and I was a counselor to the organization called HICAP. The acronyms mean Health Insurance Counseling Advocacy Program. In addition, I currently work part-time for a local hospice company. Lastly, I'd like to mention, Jeannie, is that all the information I'm giving you is from my personal experience, and it's from California. Different states have different resources and laws. The next thing is, I know firsthand the demands of caregiving. When you're a caregiver, you have multiple responsibilities. And when I became a caregiver, I knew nothing about it, zero. Although I had a lot of secretarial experience, and that saved me a lot because I was able to take a lot of notes. I'm very organized, and that helped also. I'm trying to think. What I didn't do, and I don't know if I'm repeating myself, but I didn't reach out. I did get my head out of the sand. Let me share with you my very first experience as a caregiver and advocate for my parents. I don't believe I mentioned this, but I was a long-distance caregiver, so my parents lived a good 4 hours away from me. Knowing that, and also I'm just prefacing you my information. At a previous job, I overheard our executive director and a physician talk about how they witnessed physicians being more attentive to the patient when a loved one attended their routine medical visits. That always was ingrained in my mind. So we're going to fast forward to that, Jeannie. In 1990, my dad had a mild stroke called a TIA. And shortly thereafter his stroke, he visited me, and I noticed that he looked very weak. His color was ash. He was unstable, and I thought, wait, this isn't my dad. So in speaking to my mom, we talked about his medical situation, and she said she had an upcoming doctor's appointment. So I says, Mom, do me a favor. I'd like to attend this meeting. She says, okay. So I getting my ducks in a row. I took pen and paper, and I ended up taking up Dad's medications. So we go to the doctor's office. We sign in, do the usual sign up, and lo and behold, we sign up. We're sitting in the back of the lobby, and I notice, if you recall, if you go to a doctor's office, the receptionists and nurses and things are up front, the aides are up front, and then the physicians are in the back, right, getting their files, reading their files. So I recognized there was a physician running around, literally bouncing off the walls, and I said to myself, this guy's weird. I thought, he's a little hyper for me, and in my mind I remember Jeannie saying, Lord, please don't make this be my dad's doctor. So sure enough, waited a few more minutes, and then the door opens to the doctor's office, and they call out my dad's name. Mr. Garcia, who's greeting us at that door? It was that doctor that I had asked not to have.
Oh, God.
So we walk into the doctor's office, and again, this is my very first experience as a caregiver to my parents, and even advocating on their behalf. So we walk in, and I didn't know what to expect, and, we had the usual greetings. My dad introduced me to him as my daughter, et cetera, et cetera. And he says, I interrupted, and I said, "Hi, doctor, blah, blah, blah." I says, "I have a few questions to ask you regarding my dad." He got very rude, curt, and short with me. He says, "Well, I'm not done diagnosing your dad." He says, "Ask me in a few minutes." And I thought, I immediately shriveled in my chair, and I thought, oh, boy. So I sat there. He had looked at my dad. It was a follow-up doctor's appointment. And then he says, okay. He says, "What questions do you have?" So I says, I have a couple of questions. I said, he's on medication. He's not looking well. I explained to him what happened. As a matter of fact, Jeannie, he even fell at my house. And if he hadn't have fallen on soft, muddy water, he probably would have had a stroke, or who else would have known because, of side effects of his medication.
Mm-hmm.
So back to the appointment. So I'm asking him questions, and I asked him, why was this prescribed and things of that sort. So we came to the medication of Aricept. Now, like I said, mind you, my dad had some TIAs, and he was a neurologist. So I asked him about Aricept. I says, well, why is he on this prescription? He says, because a family member informs me. And this is what he said, a family member. A family member informed me that he was having memory problems. I says, oh, okay. And I says, okay. So I went on to other medications, and I started thinking in my head, okay, I've got 4 other siblings, 3 of them of which I know are nowhere to be found when it comes to taking care of my parents. And the other one works, so I know he hadn't, gone. So we're talking, and I says, well, what family member are you talking about? And he says, he continued, and he kind of distracted me. So we continued, and then I'm trying to think what happened. Oh, gosh. We could continue to talk, and he says, I says, what family member? I says, if you don't mind me interrupting, I said, Dr. Smith, I says, what family member told you this? And he says, your mom. And I says, oh, okay. So again, I says, well, okay, being that he's on this Aricept, I says, can you tell me what tests were given and or how you diagnosed it? And he got upset with me. He says, well, your mom told me this, that, and whatever, and he started getting really upset. And then so I continued to question him even more, and he got more upset. And again, this was my first time, so it's not as if I'm experienced and I know to be even more assertive or even to be rude back. Sometimes you just have to get their attention. So he just got upset and frustrated with me, and he grabbed my dad's file, and he tossed it onto my lap. He says, here, he says, you seem to know it all. And I thought, oh, boy, this was interesting. Oh, yeah. So, and needless to say, we ended up leaving abruptly. We left, and I was fuming leaving the door, and I told my parents as we got into the car, you're never returning to this doctor's office. I don't care what you say or what you do. So, again, what came into my mind was the director and a physician assistant stating that it's better that an advocate goes so they'll know what's going on. See, my mom at her generation were the late 80s.
Right.
Everything that the doctor says, they do it.
It was God spoken, really.
Right, exactly,
yeah.
Exactly. Mm-hmm. So what I ended up doing, again, I was furious, and I drove all the way back home, and me getting my curiosity up, I thought, what's the deal with this guy? So I looked into it even more, and I got on the computer, and I ended up going into his records. I paid maybe, at that time, I think it was about $10 to get a background history from this physician. Guess what? He had been picked up twice for self-prescribing steroids.
Uh-huh.
So that was his issue. And how would you know that, Jeannie?
You wouldn't have
you
known
wouldn't.
it.
Right. No. So that was a big eye-opener for me. Like I said, it was a real big eye-opener for me. Yes, I complained to the medical society, but a lot of times things fall on deaf ears,
Mm-hmm. I don't think it's a little, it's not so easy for the physician now.
Right. Exactly, because we're becoming more educated and aware.
That's right. Right.
There's the population has grown immensely. There's a lot of millennials taking over as caregivers. It goes on and on. Fortunately, and I know they tell you never to do this, but I quit giving him the Aricept. And guess what? He turned back to his old self. He was fine. So a lot of the symptoms and stuff were due to the medication.
Yeah.
They were due to the medication. So offward and upward, let me give you a couple examples of a misdiagnosis for Alzheimer's association. It could be a urinary tract infection. And men do get urinary tract infections. It could be a lack of vitamin B12, underactive thyroid, a bad reaction to medication, or polypharmacy. Polypharmacy is too many medications. And I'll give you an example. When my dad passed away and my mom was left in Southern California, and I was, again, her advocate and caregiver, when she was in Southern California, she was on 13 medications, Jeannie.
Oh, my God.
Brought her up here, and that's just a tip of the iceberg, Jeannie. I brought her up here. Guess what? I downsized her to only 5. So it's very important to be an advocate for your loved one, even if. And my mom was competent; she was coherent, but really, she needed a sidekick. She needed someone to kind of oversee her. One person doesn't know it all.
Right. No, it doesn't. But I also think it's good when you have a list of the medications and you take them in with whatever physician you are with, and have your primary look at it and say, are these all necessary?
That's a very good point, Jeannie, and I'll tell you why. Because I eventually created for my parents and other family members, I call them cheat sheets. For example, if you're my mother, you're on A, B, C, D, E, F medication. Who the doctor is, who prescribed it, and the dosage. Because 99.9% of the time you go to a doctor's or to the hospital, they're going to ask you that. You have this way. You're not back at memory thinking, oh gosh, they're on this for that or this for that. So I did that. I also made a list of their physicians and what they did, what they treated mom. Also, a family caregiver list in case of an emergency. That helped me immensely, being organized, getting all that stuff together, because like I said, when you're in the middle of a hurricane as a caregiver, you're thinking of all these documents to locate, what medication she's on. You're talking to 10, as many as 5 to 10 doctors, and you don't know what's happening. So that's a great point to pick up on, Jeannie, that, document everything, have everything coordinated. The other thing that I learned, pardon?
Okay. No, go ahead. I'm sorry.
The other thing I learned, too, was taking extensive notes. That was a must for me. Again, I think that was brought up, me being the executive secretary that I was. So let me provide you, and again, let me provide you with quite a few resources, okay?
That's
again,
great.
Sure. The Alzheimer's Association, their number is 1-800-272-3900. They do offer respite. However, that's in Northern California. They have a respite fund for caregivers. They do not pay the caregivers. For example, if I wanted to take some respite, they would provide, I think at that time the amount was $1,000. They won't pay the caregiver directly. They will pay the facility who is providing a respite to your loved one. So let's say I want to take a week off and go visit my other family in Southern California, and they will pay ABC Home Health Care or either the facility wherever you're holding mom, wherever they're taking care of her. So that's a big plus, I feel. And I know there's there's a big lack of respite care, but I do have some other resources for your listeners. So, again, there's the respite fund from the Alzheimer's Association. They have a 24/7 hour helpline. Again, they're available 24/7, hours a day. Support groups. They have family care consultation with family specialists for assessment and planning situations. They can even, I don't even think about this until afterwards. Of course, you think about it afterwards. But they'll even do, because I had a fractious family, they'll even do a 3-way call, and they'll get them all online, and they'll have someone educate you and provide you resources on handling different situations. Because a lot of times and this is with any relationship, whether it's a medical relationship, a coworker relationship, a family relationship, you're not all on the same train track. So it would help someone to get someone experienced and knowledgeable, number one, in the disease, like the Alzheimer's Association, and they could learn and they know the dynamics of the family and things of that sort, and they'll help support you and guide you to the right answers. I mean, I wish I would have known that, because I would have gotten my family members on the phone to understand the disease, not only as the disease, but as a caregiver and their struggles through the journey. They have educational seminars, materials, and newsletters for families and professionals. They have a lot of translated materials in Spanish, Chinese, and Vietnamese. And they also have a medical alert and safe return. That's at a cost, but all of the above information is free. You just have to go onto your local Alzheimers.org website and check it out. The other resource, and this isn't Alzheimer's, but it's the American Cancer Society. Ditto to them also. They have a 24/7 hour hotline. They have resources, and let me name a few, Jeannie, if I may. They have free cancer information. Their 1-800 number is 1-800-227-2345. They have printed materials, and anytime a lot of these hotlines that you call, you can ask them for materials to be mailed to you, and they'll happily do that. You don't have to necessarily go in and make an appointment at the Alzheimer's Association or the American Cancer Society. You can call their 1-800 number, and they have a slew of materials for you to learn from. Back to the American Cancer Society, and we're very fortunate as a family to take advantage of this benefit through the American Cancer Society. They have a program called the Hope Lodge. It's a program that places the caregiver in a facility during treatment. And I'll give you an example. What they do is, again, for example, my sister in Southern California had a stroke, and she had to have a severe surgery in another facility further south. Well, because it was a good hour away from her hometown, the American Society provided her children a full 3-week stay at the hospital. And it was free because she enrolled, the daughter called up and enrolled themselves into the American Cancer Society, and they helped her take advantage of the benefit. So that was for a whole week. Unfortunately, the children had to stay longer. So I called up and I asked, and I said, listen, we thank you very much for your services, and we don't want to overstay our welcome, but this is a situation with my sister. I says, can you offer a discounted rate? And they said, sure. So they offered the discounted rate of only $35 per day, and that was even better yet. Who can't afford, $35 a day compared to what the average daily stay is? And that's nowadays, I believe it's $100.
Easy.
So,
yes.
Yes. So again, we as a family were fortunate to take advantage of that benefit. The other benefit that I utilized myself, because I wanted to know more about her cancer, I literally, Jean, was on the phone from 11 o'clock to 1 o'clock.
I believe you.
On the American Cancer Society line. Thank God them. God bless them. And they educated me about my mom's ailments. And unfortunately, what I learned more and more, it wasn't a good situation for my sister. Unfortunately, even though she had cancer, she had other ailments. She had high blood pressure. She had diabetes, and she didn't take care of her health. It's just really unfortunate. The American Cancer Society also has free rides to treatment, to and from your physician appointment locally. You have to call your local American Cancer Society, and they'll put you on a schedule for that. They also have patient navigation. I like this option myself. They have patient navigators available in most hospitals. They help patients get the services they need for the rest of their cancer care team can focus on the treatment. Patient navigators can also provide cancer and treatment information customized for each patient's diagnosis. That's a great benefit. And then the other one is a Reach to Recovery. A Reach to Recovery, it's a program that matches breast cancer patients with trained volunteers who have similar diagnosis and treatment plans to provide more personal one-on-one support. So those are a couple of the nonprofit organizations that, again, I've worked for and have volunteered for, and I've learned a lot just, working for them. The next one is for a caregiver to understand and learn what a geriatric care manager is. They are a big resource, and I say big. If you could afford it, they can be costly, but even if you get your siblings together to pitch in for an hourly or 2 consultation with them, it'll make all the difference in the world. They are called, again, a geriatric care manager. A lot of them are either nurses, former nurses, or former social workers. So they're familiar with your local area, what facilities are good, what facilities aren't good. They'll educate you with regards to placing your loved one in a center, things of that sort. They have all the inside information for your local area. So learn that if you can. Another resource that I learned, Jeannie, was HCBA, and the acronym stands for Home and Community-Based Alternatives. It's a county, and I believe they're in several counties, but again, don't repeat this. It's a waiver program for individuals on Medi-Cal, allowing them to stay into their homes. They get on and in addition, because there's so few in every state, you have to get on a list. So you have to be diligent and do your research. Again, it's called an HCBA waiver, and it stands for Home and Community-Based Alternatives. For example, if I'm not mistaken, we have a waiver, and there's only 5,800 spots available here in the Valley. Well, we're asking for 18,000 spots, which is a big jump, and it would help immensely, especially if it helps the individual stay at home. So for beginners, yes, for beginners, for beginning caregivers, I suggest first start off, and it'll be free. Again, you have to do your research. Is for the EAP programs. It's an employee assistant programs. Not all companies have this, but the larger ones do. Again, it's called an employee assistance program. You can call them up and saying, listen, I'm a caregiver to my mom. I'm stressed out. Are there any counseling services that are available that I can go to, blah, 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 and they'll help you with that. A lot of times, depending on what your employer pays for that program, there's a lot of free consultation, either your initial consultation to an elder care attorney or it's a consultation to, family psychologist. A lot of times, like I said, a lot of those services are free depending on the program that the employee offers. The next thing is I highly recommend the caregiver to look into the Family Medical Leave Act. As I mentioned early, Jeannie,
yes,
I was talking about California. In California, we have up to 12 weeks paid leave. Okay, and in a lot of these programs, there's a lot of requirements and specifications, and some employees participate and some don't. So do your homework. The next resource of Family Medical Leave Act. The Area Agency on Aging. Every county has one. They're called the Area Agency on Aging. Your VA administration, if they qualify again, they offer respite and day care. You can look also throughout the city. A lot of cities have an elder care resource book or other resource books that's available The other thing is the 211 here in California. 211, it's with United Way. They're here in California. They're another good resource. The other thing that I ask your caregivers to do, ask your parents, do they have a long-term care insurance? You'd be surprised. Some of them do. And if they do your research on that, because they may offer, it may be one of the benefits that they'll pay for a caregiver to come in and take care of your loved ones because they paid for this long-term care insurance.
Right.
Again, ask family members, do they have a sister that's a nurse, a father that's a physician? Do all your research and continue to ask them and go on and go on and go on. I'm aware, too, the American Cancer Society, because from personal experience working there, they're affiliated with, one of their resources was a very helpful organization called, they're based out of Los Angeles, they're the Cancer Legal Research Center. I had an incident where someone had called and they were getting limited information from a hospital here locally. So I called them, and they were very helpful. Within a couple of days, they sent me answers, and they gave me the laws that the hospital are required to provide to a patient in a hospital. Other resources for respite, there's an organization, you may have heard of it, Hilarity for Charity. It's respite funding. They have scholarships available. Another resource was Elder Helpers. That, unfortunately, is only online. You have to do your research again there. They're only online, unfortunately. The next I would say is every state has a caregiver resource center. Okay? Umbrellaed under that is the organization that I worked for and volunteered in. It's called HICAP. It's Health Insurance Counseling Advocacy Program for people on Medicare. It's a statewide health program. It's also known as SHIPS. And that's important to know right now, too, Jeannie, is because enrollment period is coming here in California.
That's right. Just let me say one thing. I understand that we're in SHIP because I was a counselor over here at our HESCO.
Okay.
For what you were just talking about, SHIP. We were the ones that would help guide people, not tell them what to get, but guide them through the insurance.
Oh, right. And educate them on their programs. A lot of their program, their health insurance plan.
Right. Yeah.
It's so important to advocate for your loved ones.
Yes. Because I didn't mean to interrupt, but I was my God, I don't normally hear people say SHIP.
Oh. I know, and that's a hidden secret. It's free.
Yes, it is.
That's the thing. It's free. And that was an eye-opener for me, Jeannie, because, again, we educated family members in the 80s and 85s, and it was an eye-opener for me because a lot of people that came in, and the reason why they came in is because their spouse passed away, and they knew nothing, and they were primarily women. They knew nothing about their health insurance plans. And they were taken advantage of immensely from health insurance companies. It's horrific. So, again, learn your health insurance plan. Yeah. And, again, SHIPS, there's one in every state, and I call it HICAP because that's the acronym that I'm used to, that I'm familiar with, but, again, it is SHIP.
Yeah. When you say SHIP, because we called it SHINE. We were SHINE counselors.
Okay. Wow.
But you never know. It's a small world, Susan.
Yes. See, and I'll give you another situation. Here in California, it's called Medi-Cal. Back east, it's called Medicaid, but they're the same program.
Yeah.
Some people think they're two different insurance plans. They're not. They're the same program. Okay, so another interesting resource that I learned about was UCSF, the Memory Center. They offer free scholarships for evaluations for people on that has Alzheimer's. If you're saying, hey, listen, mom's having memory problems, blah blah blah, you can contact them. Again, depending if funds are available, but do it. And they do, if funds are available, they'll do it. They may say, no, we don't have funds available. They may give you like a sliding scale price. That's another option, too. Or you may ask them, do you expect to have funds in the future? And if so, when? Again, that's the UCSF Memory Center. Another resource that I had, which was beneficial for me, they were called Genworth Financial, and they will provide the cost of cares for your specific city. Again, Google Genworth Financial, and they have a little app on their website, and they will provide you a cost of care for your specific city. And that's a big eye-opener. It's not a good, unless you're very well off, it's not a good site. The other thing is do your research. Thank God for the Internet, Google,
right.
Facebook. I'm an avid listener to several podcasts. One of them that I listen to immensely is the Senior Care Authority. They have everybody on their podcast from A to Z. Elder care attorneys. They had a pharmacist. I forgot the name of their term. But they have, I didn't even know this until I learned this on the Senior Care Authority. They have pharmacists that specializes in geriatric medicines. You know, a lot of that has to do with, pardon?
Yes, that's a lot of good information you're giving us, Susan.
Right. That's why I say I'm glad this is being recorded so caregivers can go back, take their notes, and utilize it.
Right.
Do your homework. Get second and third opinions. And I know it's easy for me to say, and it's a struggle, especially if you're a caregiver. But if your gut instinct tells you something, listen to it. Go get other opinions. I mean, it's just amazing how much you'll learn. Lastly, and I know we're probably running short, I'd like to give you a few recommendations of books I've read.
Oh, yeah.
First one, obviously, is the 36-Hour Day. And I'll be honest with you, I see a lot of people recommend it. I never read it. It was too harsh for me. That was good, bad, or indifferent, but I hear a lot of people enjoy that for, information and educational experience. The next one I would say was The Patient's Patient's Handbook by Leslie Michelson. It's a book every caregiver should read. It's from A to Z. I mean, he will even help provide you questions to ask your physician at appointments. He'll clarify specialties. He provides email and websites that the persons can do research in their county, what physicians are specialized in this in their county. I mean, it's just a great book. Another book that I read was outstanding, and this was recent, 47 Secret Veteran Benefits for Seniors by Victoria Collier. She's an elder care law attorney with the VA. It's a short book, understandable, not military terminology, and in case you want to buy it, it's $45. All these books, I'll be honest with you, because I'm on a budget, I rented all of these books from your local library.
Oh, yes. Always go to the local library. You can get it and read it and bring it back, and it's
right.
Really,
and you can renew. You can renew it if 2 weeks isn't enough. You call them and you can renew it. The other great book, and this is called The Silver Lining, and the author's name is Holly Jacobs. It's a supportive and insightful guide to breast cancer. And granted, she focuses on breast cancer, but it's for any type of cancer, really. I found it very informational. It's a beautiful book. It could actually be a table book, beautifully written. A little bit about her history. She is or was a previous nurse. She was a vegan, if I'm not mistaken. Read the book. So she was doing all the right things, and she ended up getting breast cancer in both breasts.
Oh, okay.
The other thing is attend community workshops. Hey, some of them are at a cost, but call the organization up who's holding the conference or seminar. Ask them. They too offer scholarships or grants to attend the workshop. Their workshop.
Right.
And then and I don't have to repeat it, but I'm going to anyways.
That's okay.
Respite is a must, Jeannie. Respite is a must for the caregiver.
Agree.
You know, I don't have stats. Unfortunately, I wish I did.
Me too. Yeah.
Stats for the death of a caregiver are very high. A little personal story.
Death.
A personal story. I was so stressed out that I ended up getting psoriasis. It was on my hands and throughout my body. It was so severe at one time, Jeannie, I had to sleep with my hands out to the side, hoping not to touch anything. That's how bad my psoriasis got.
Oh, my
Fortunately,
goodness.
it's been in remission, but it could always reoccur. But I know I acquired this ailment from the stress. And that was the psoriasis. Other people get worse diseases from the stress alone. So please take care of yourself. I know there's a lot of guilt for people. You know, being a caregiver, I unfortunately am an overthinker, but yet I appreciate that because I want to keep everything organized. I don't want to miss out on getting the information. Let's see here. Another resource for millennials, I think. Not resource. These are some tips for millennials, Jeannie.
Okay.
Be assertive. Be assertive. You'll be taken more seriously. Take detailed notes. Be a pester. Be a pest if you have to. I know I was that, and I learned that from experience because eventually they will want to get you off of their to-do list. They'll want to get you off their list. You know, keep asking questions until you get the answers. Follow up if you have concerns or if you're ignored. Another example that I went through, another personal experience, was with Mom. Mom, unfortunately, after Dad passed away, 4 months later, Mom was hospitalized 3 times, and the hospital could not diagnose her. So fortunately, the hospitals in my mom's area, they ended up sending her to Kaiser, and I had never been an advocate for Kaiser. So she went to Kaiser, a hospital under Kaiser, and we spoke to the physician, and they found out what her illness was. She had a lot of blood clots in her legs. So I communicated with the doctor. She was there a couple of days, and I wanted to ask the doctors a few questions. The nurses couldn't answer them. She says, you have to talk to the doctor. For 2 days, I tried to get a hold of the doctor. Then it was time to discharge her. I'd say they had said in about another day, and I said, I couldn't get my answers. The doctor wouldn't return my call, so I just decided, I went into the hospital where my mom was at, and we left the hospital. Before that, though, I was gathering her items. Guess who called me in the nurse's office? It was a doctor.
Finally.
Yeah, and it was a shame. It was horrible. But he had diagnosed her as having, he had pre-diagnosed her as having cancer. Well, he was right, but what happened with Mom had cancer but a few years ago, and so they went in and did a biopsy on her chest, and they removed that cancerous tumor. So since she had that cancerous tumor, she always had that lump there from scar tissue. So that was taken care of, and fast forward when she was in the emergency, the doctor was telling me, she has breast cancer, we got to start putting her on medication next week and blah, 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 and went on from there. And I says, hold on, doctor. I says, thank you for the information. We're going home, and I will follow up with her doctor. Sure enough, Jeannie, what happened was followed up with her doctor. It wasn't breast cancer for the second time. It was a scar tissue.
Oh, for goodness sake.
So you have to be on top of things. And again, it's very important to advocate for your loved one, Jeannie.
It is. It's very important. Very, very important. I just want to say one thing. I happen to find this here, and have you ever heard of the File of Life?
No.
It's a file. It's red, and we put it on your refrigerator. All your information is on there. So if the police or the fire department or EMTs come,
Are those little cards? Are those little cards, Jeannie?
Yeah, it's red.
Yes, I am then. Yes, through HiCap, they had quite a few of them. Yes,
if you put all your medical data on there, they look for it, and if they see it on the refrigerator, they take it.
Right.
And they bring it to the hospital. I'm just saying
Right.
this is another piece.
Yes.
And that they also have one that you can keep in your purse or
Well,
wallet.
you know what I suggest to my caregiver family and friends? Like I said, I did the 3 sheets, right?
Mm-hmm.
Personal information, medicines, and doctors.
Right.
Well, I put one in the trunk of my car because I was a primary caregiver, and if you recall, I'm long distance.
Right.
So I kept one in the trunk of my car in case something happened. I don't have to, all I have to think about, it's in the trunk of my car. I don't have to grab their medications, their list, whatever. It's in the trunk of my car.
Right. Mhm.
And in addition to that, and I know people don't like that, but I made a copy of their driver's license, Social Security card, and their health insurance plan. But with all of the absconding of people stealing people's ID, they don't like to do that, and I understand. But unfortunately, when you go to the hospital, Jeannie, that's one of the that's several of the IDs
definitely.
that they ask you for.
Mhm. I just think these little things. It's on fileforlife.org, and
okay.
I really think people really should have it. Even I should have it.
I don't care how old or young you are.
Yeah. I'm on a couple of medications, so I mean, and then put my doctor's name down there, and they can call him. And I think that's part of the problem, even if the caregiver had one of these, because when you're in a situation where they've been rushed to the hospital, you can't even think straight.
Oh, exactly.
So if you have this document in your purse, you personally, you can hand it to them, and they have everything.
Right. And that cuts through a lot of red tape. It cuts through a lot of red tape and time, and I truly believe it takes a lot of – I truly believe because they priorities, I'm sure, by emergency, but if you've got your act together, Jeannie, and you have all their medications and stuff, I truly believe, again, I'm sure they go by emergencies in the hospital, but if you have your act together, that's going to put you on top of a list.
Oh, yeah.
You know, by the time they're obtaining this information from another – patient that doesn't have their act together, and it's easier said than done. But if you get your act together, it'll help you in the long run.
If you take one little thing out of the equation to help you out,
right?
And it's the little things, actually, what it is. To me, this little file to have on your refrigerator and in your purse, your parents' purse, it's a small little thing.
Right,
but it has major information on it.
Right, and like you said, it doesn't have to be you a caregiver caring for the loved one. It could be for themselves. You know, if you have children, if you have children and you're a caregiver, if they have asthma or something, that would be so helpful.
It's just like Betsy was talking about. I believe she does wear it at home. She has a bracelet that she wears.
Right. There's that medical alert ID.
Yeah, because she is a caregiver for someone at home.
Great.
So if something happens to her, they see it, and they can go to her home and find out who's there and who's the one that's ill.
Right.
So that's another piece of the equation.
Exactly. There you go. Those tags.
Yeah, it's a tag or something to let people know that you are a caregiver.
Right, it's a bracelet with an ID of some sort. Some of them they have various types. I know the Alzheimer's Association has one. Again, but that's at a cost, and it's called like Medic Plus Alert. It's a Medic Alert Plus Safe Return. It's a national registry and identification bracelet for persons with memory loss and their families.
Right. So that's another piece of the equation. Some of these things, they may cost a little, like this File for Life, I'm not sure how much it cost, but you know what? Even if it was $5 or $10, I mean,
right.
Do you put a price on that?
Oh,
to make your life to make yourself much more comfortable? Should you or someone else is in the hospital? It's just there's so many things.
This is another thing
together.
This is another thing to add onto the list. Of course, it's an endless list.
Yes.
But I've had 2 hip replacements, and because I've had two hip replacements, whenever they cut into me, there's a high percentage of me getting an infection because of the hip replacements. So who would know that? If I fainted and all of a sudden I don't have this information on file and this doctors start to slice and dice, In addition to that, whenever I go for a dental appointment, it's a requirement that I take heavy doses of antibiotics before dental surgery or before the dentist, period.
Mhm.
So again, if this is on your file, because I put that on my little file, 2 hip replacements. I even put a request on what hospital I'd like to go to. Not all hospitals are the same.
That's right. I agree.
So like I said, if your loved one is allergic to bees or nuts or something, that's very important to be on that file, what their allergies are.
Mhm. It's just a wealth of information for the next person that's going to be taking care of you and that doesn't know anything about you.
I know. Yes, it is. It really is. And you know as well as I do, Jeannie, that's just a tip off the iceberg.
The iceberg here, yeah.
But again, I encourage people to advocate and check out resources, get second and third opinions. And I don't necessarily mean that for doctors. I do mean it for doctors, but also other resources. And continue to ask them questions. Okay, you don't have these services. Are you familiar with another organization that may direct me elsewhere? And that's how I've found all of my resources.
Mhm. You did a lot of legwork, and so now you probably have it in a binder somewhere.
Do you know what? Personally, I have a 15-page document that I created for local resources. And coincidentally, Jeannie, yesterday, and I knew of this organization, and again, that was local here. Not all cities have them, but it's called Making Connections. Do you know how many resources? And it's for nonprofits. It's for Fresno County. The book is only $10, but do you know how many pages that book has? 231 pages.
Wow. And that's just for Fresno. Is that right?
Fresno County, which are other surrounding areas.
Uh-huh.
But that in itself is a wealth of information. But again, those are just nonprofits. There are a lot of other local organizations that have, resources and different prices. And the other thing I want to just say is it does help you do your research. If you're getting a caregiver or a home health agency for a loved one and you're paying out of that pocket, guess what? You're interviewing 4 different health agencies. Guess what? There's 4 different prices.
That's right.
So it behooves you to do your homework. It really does.
Definitely.
A lot of them
agree with you.
Have requirements that you have to use their service for 2 weeks. Well, I don't know who in God's worth can afford 2 weeks respite for someone taking care of them for 24 hours a day. If that's the case, I'll take my mom with me on vacation.
Right.
And then I did find a local resource that will do it, by the hour. There were no minimum requirements. Yes, their fees may be a little bit more hourly, but it works out. You get your respite and you save money instead of having that firm requirement of having to stay with that home health agency for a minimum of 2 weeks.
I agree with you. It's all it is. I know we have respite care here, but, in our HESCO Elder Services will help will guide you to some of the respite care and provide all the prices up front for you to know.
Oh, that's great. That's great.
So, that's a nice little area, and
right.
But not a lot of people know about these elder services throughout the United States. Each one has one, but it's always called different names. But you can always call up your elder. I know we have
Area Agency on Aging, the AAA Area Agency on Aging.
Yep.
Yeah, that's who they're umbrellaed under over here in the Valley.
Are they really? Okay.
Yeah.
I would love you to come back on again, Susan.
Sure, that would
Not
be
right
great.
Now. I just think you have a wealth of information, and maybe we could dissect some of these agencies and what they actually do a little bit. I don't know if that's too much to ask of you.
No, you know what? Because of my caregiving experience, again, I mentioned it. My head was in the sand. I didn't come up for air. But people need to know. And again, because I'm currently volunteering at the Alzheimer's Association, I learned so many resources from them. It was phenomenal. As a matter of fact, this is my calling. I want to study. They just received money to have volunteer care consultants. They will educate you.
Excellent.
Yeah, and I want to do that. So I'm open, Jeannie. You have my number.
Yes, I do.
Feel free to call me at any time.
I really will.
And
I mean,
much love to Betsy, the New Jersey
definitely.
Nudge.
But she got her point. You know, I mean, it's like anything. For us, is for everyone, nothing's going to change, Susan, if you don't do anything.
Right, and it does take a community. You can't.
Really does.
And not only that, one person can't do everything. You know, I flay off all of these resources like they're in my back pocket. It's taken me years to find them out, and it's only been, I'll be honest with you, I've been doing my research only within the last couple of years on these programs and things of that sort. And I do attend a lot of workshops. That's where I learn. So don't think that I know it all and I know all these resources. I don't. I learn them. And I enjoy learning them. That's the other thing. I have much compassion for helping people out.
And that's you probably, obviously you do wonders with that, you know.
I try. All we can do is try.
Well, we all try. We all try to do it and try to do the best thing we can for the human race and help everyone out as much as we can. You know, have we missed anything, or that maybe we'll have to revisit it when you come back on?
No. Again, we could break it down on different things. You know, once we get offline and talk about different subjects, what you think are important. I have your demographics now because you do want to focus on them because they will be our future caregivers.
Right, they are.
There's a lot to learn.
There's
a lot
to
learn.
Yeah, they do listen a lot.
Jeannie, again, much appreciation and thanks to you.
Thank you.
And the Passionate Care Network. I really appreciate this platform. And again, I look forward to hearing from you in the future.
Oh, definitely. You know that. It's this journey. I'm not sure where it's taken us all, but I know it's taken us someplace.
Right. You know? If you know the statistics that I've learned, it's going to be the millennials' journey.
Mm-hmm.
Because
here we are. You're going to be helping the millennials.
Well, and if you know the stats that I know, it's called the Silver Tsunami because beginning in 2010, every day, not millennials. My gosh, every day 10,000 people are retiring over the age of 65 every day from the year of 2010. That's a big amount of people that are retiring.
Yeah, it's huge.
Right, and they call that the Silver Tsunami.
Yeah, that's something I never heard that phrase, but that's pretty interesting. Yeah, it really does fit. It does fit.
It is because everybody, all of us, baby boomers as we're called, since 2010, from day one, there's over 10,000 baby boomers retiring. So they've got to fill that void and caregiving and things of that sort.
Yeah, and that's where we all come in too, is education.
Right, exactly. Thanks again, Jeannie, for your time and effort to this Alzheimer's Awareness Month.
My pleasure, really, Susan, because, if I hadn't reached out to Betsy in the very beginning, I'm sure another station probably would eventually have reached out, but if I hadn't, I wouldn't have been involved in this, and I'm really pleased with that I am involved in some small way,
Right. No, I think it's going to be a huge way, Jeannie.
It is. It's going to be good.
We have to get the word out, and thank you for connecting the dots.
I'm trying. All of us are trying to connect those dots.
Right.
Yeah.
Thank you, Jeannie, very much.
Oh, thank you so much for being on my show. I really appreciate it. Is there any words that you'd like to leave to the audience before we close?
No, I just think it's very important to do your research. Do your research, and what I mean by that, homework. Ask around of other people's opinions, whether it's a medical or whether it's an organization. Some organizations are better than others. And when you get someone at the customer service, for an organization, same thing there. Some people are better than others. You can call one person, they're behind that same desk, and she'll say, oh, no, just transfer you to extension 123. Where if you call that same department, it'll be the girl right next to her. She'll say, oh, you know what? I think you need to talk to department of our hospice department and talk to Jeannie at extension blah, blah, blah. Mm-hmm. There's different strokes for different folks, and I just say, leave no stone unturned, Jeannie. As a caregiver,
that's right.
Leave no stone unturned.
I agree. Well, with that, words of wisdom from Susan Fernandez, I want to thank you all for listening to the show today, and Susan. And again, if you have any questions, you can always contact me at jwhite7033@comcast.net. Again, this is Jeannie White from Social Connections on Passionate World Radio. I want to wish everyone a great weekend, and I'll see you on the radio. Bye.